President Trump's signature and massive piece of legislation is not quite a finished deal. The House taking another crack at this moment and could be added late into the night or even into tomorrow morning, leaving Americans anticipating how it will affect their daily lives for better or worse.
I'm Ryan Gamboa, and I cover topics in rural Cass County, Missouri. Congressional cuts to Medicaid can potentially leave rural hospitals and their patients vulnerable. I'm amplifying the voices of rural America and delving deeper into the potential impacts of the cuts. Dinner time in Harrisonville draws a crowd. Willie Ogden drove from Garden City, Missouri.
10-15 minutes.
What he really came to do was pick up his mom from Cass Regional Medical Center.
She just had some stomach issues, we'll put it like that.
Jessica Thomas is eating for two. She's expecting a new baby in November.
We are very excited. We prayed for this one.
Thomas tells me she's a Medicaid recipient. Access to her local hospitals sometimes isn't enough. She's a high-risk pregnancy, and in her first delivery, Kansas City was her only option.
An hour drive can definitely change a lot of things.
The GOP-led Big Beautiful bill that passed the Senate on Tuesday would cut over $1 trillion in Medicaid benefits. The Kaiser Family Foundation reported in May that 2 in 7 Missouri Medicaid recipients live in a rural area. Half of those recipients are children. The Missouri Hospital Association tells me changes to Medicaid will impact hospital service reimbursements, meaning some rural hospitals may need to cut services.
We could be looking at a fairly large crisis relative to overall funding for hospitals through Medicaid and then the structure of our rural health delivery system.
Dinner might look different for Thomas, as she could be forced to pay for health care out of pocket.
Lucky right now that we're able to have access to that.
Ogden, he worries about his neighbors and the food taken from their plates.
Put yourself in our shoes. Rural communities don't have a lot of money. We work hand to mouth. Put yourself in our shoes that don't make a lot of money, and maybe you'll understand something.
In Harrisonville, Missouri, Ryan Gamboa, KSHB 41 News.